It's my pleasure today to welcome you to this symposium in a virtual format that is organized with Lymphoma Hub, and in which we will address the sequencing of therapies in patients with high-risk relapsed or refractory lymphoma on CLL. My name is Gilles Salles, and I'm the Chief of the Lymphoma Service at the Memorial Sloan Kettering Cancer Center in New York, United States. And with me today to discuss these topics, we have a panel of distinguished faculty, starting with Professor Francesc Bosch from the University of Vall d'Hebron in Barcelona, Spain. He will be followed by Dr. Loretta Nash-Tupil from the MD Anderson Cancer Center in Houston, United States, who herself will be followed by Professor Stephen Le Gouil from the University Hospital of Nantes in France, and we'll conclude with Professor Andy Davis from the University of Southampton in the UK. As you know, in recent months and within 1 year, there have been a dramatic increase of the number of available therapies that have been approved by different agencies in Europe or United States for the treatment of patients with lymphoma or CLL. We have shown this approval on this slide, and you can really realize that the field is moving extremely quickly, and this includes obviously some targeted agents, BTK inhibitors, but also some other new therapies such as venetoclax and PI3 kinase inhibitors. We have, of course, the immune checkpoints. We have some new monoclonal antibodies. We have other targeted therapies, antibody drug conjugate, and CAR T-cell. So you see many drugs, obviously not in all the same entities, but this is a progress that has been made and pushed forward with the development of research and with your investment, you and your colleagues, in clinical research. So based on these many options, what we want to address today during this symposium is how to make the optimal use of these therapies for our patients. And in order to try to answer that and open the discussion with you, we will have, sequentially speaking, Professor Francesc Bosch, who will discuss the treatment options in patients with ibrutinib-resistant CLL, a key topic given the approval of BTK inhibitors in many places of the world, but also patients failing this therapy. He will be followed by Dr. Nash-Tupil, who will discuss what are the available options and choices that are open for patients with early relapse in follicular lymphoma, from new therapies to transplant and others. Then Professor Stephen Le Gouil will discuss the different options in patients with TP53 mutation, a mutation that is associated with a very poor prognosis in patients with mantle cell lymphoma, usually chemo-resistance, and he will discuss with us how to adapt the treatment of this patient. And Professor Andy Davis will conclude in the broad spectrum of primary refractory patients with diffuse large B-cell lymphoma. I said broad spectrum, it's a rare event, 5 to 10% of the patient, but it's a difficult situation. But again, many drugs have been recently being available or will be made available, and I'm sure that Andy Davis will bring us through a very nice review of this field. We'll then have time for a roundtable discussion with all the faculties, and you will be able to ask questions which we will try to answer during this live session. So thank you, keep online, and we will move on to the first presentation of Professor Bosch. Thank you for joining us for this Lymphoma Hub Symposium.